All right, welcome everyone. I am Aubrey Kotick. I'm part of the new COTAC team, and we're so excited to have you with us today for our Lunch and Learn on the new Brush in a Box Toolkit, and with Smile California here presenting on some resources for National Children's Mental Health Month. Okay, some housekeeping notes. So the meeting will be recorded and will be posted on COTAC's website. And questions are welcomed throughout the presentations, and we will be answering questions at the end of each presenter's block. But please stay muted until you are called upon or until you have until the end of the presentation. Follow-up materials and a link to the recording will be sent afterwards, and any other information that's shared today, including links to Smile California's resources. So hold tight for that. And then please take a minute at the end to complete our evaluation survey so we can continue to make these better and better for you. So today, like I said, is all about Brush in a Box and Smile California resources. And we have two meeting objectives. The first is to introduce and walk through the new Brush in a Box toolkit from the Office of Oral Health, the resource that was designed to help fulfill LOHP work plan activities, promoting toothbrushing programs and oral health education in early education and child care programs. That's 2.1B6, which is great. And the second is to review Smile California resources, including their social media gallery and specific resources that can be used for promoting National Children's Mental Health Month, which is next month. And our speakers today are Sierra Hunt from the Office of Oral Health, and Sal Cruz and Maria Mansour from Smile California. And let me read through a couple of brief bios from our presenters, and then we'll kick it off. So from the California Department of Public Health, Office of Oral Health, we have Sierra Hunt speaking with us today. For the youngest of 13 children, Sierra grew up in Humboldt County with a love for the outdoors and a passion for helping others. After graduating from Humboldt State University in 2007, she worked as an education coordinator for a nonprofit agency that ran Head Start and Early Head Start programs, where she was honored by the California Association for the Education of Young Children for her outstanding work with children and families. In 2016, Sierra worked as an education manager and manager of the Healthy Connections program at a nonprofit agency in San Francisco. It didn't take long to realize the city life was not for her, and she returned to the Redwoods, where she began working for County Public Health as a health education specialist. In 2020, Sierra obtained her master's degree in psychology with a specialization in child and adolescent development. And in April 2022, she accepted a position with CDHP as a program consultant for the Office of Oral Health. And on behalf of Smile California, Sal Cruz and Maria Mansour will be presenting. Smile California is the Medi-Cal Dental Program's campaign to help more than 14.5 million members increase utilization of their dental benefit and increase provider participation in the program. Campaign activities are designed to increase overall program awareness by educating members, encouraging trusted community level partners to play an active role in member education, and increasing access to Medi-Cal dental providers by encouraging provider participation in the program. Maria and Sal are senior account managers at Runyon Saltzman, an integrated marketing and communications agency offering a wide range of services under one roof: strategy, creative, production, advertising, and more. Runyon Saltzman is the marketing and communications contractor for the Medi-Cal Dental Program's Smile California campaign. We are so excited to have you all here with us today, and I will go ahead and kick it off to Sierra.
Hi, everybody. It is absolutely fantastic to be here today. I am just honored to see how many participants have signed up to learn about Brush in a Box. Any of you who know me know that I am extremely passionate about early education and childcare toothbrushing and have quite a bit of experience on the topic. So it is my pleasure to introduce this toolkit to you today. We're going to go ahead and launch a poll first. So if you could oh, there we go. All right. So our first question is, how comfortable are you with the idea of helping to implement an early education and childcare toothbrushing program in your county? Wow, look at you go. Look at this. Oh my goodness, fantastic. Answers are rolling in. with very comfortable, somewhat comfortable, neutral, uncomfortable, or ask me again after this lunch and learn. We'll give it just another moment here. Okay, it looks like everybody answered. So, oh, okay, we look at, oh goodness, almost half is already feeling comfortable. That's fantastic. About 30% somewhat comfortable, 18% feeling neutral. There's a few that are still feeling uncomfortable, and then a few that say ask you again later. So we will definitely do that. I'm hoping that we're going to get close to, if not 100%, feeling very comfortable by the end of this. Thank you so much, Aubrey. You can go ahead and take that poll down when you get a chance. Or maybe I can take it down. All right, again, thank you so much for being here. And I just want to start off again by saying that this is a topic that I'm extremely passionate about. I have worked in Head Start and early Head Start programs as a teacher, actually doing classroom toothbrushing, and that I have also worked as an education coordinator, overseeing and helping to implement these programs, and as a health education specialist who created the idea of Brush in a Box and having all the tools and materials that you need ready to go in a box. So with that, I'm going to go ahead and start to walk through this toolkit with you. And throughout, I will tell you a little bit more about my hands-on experience so that it can help the local oral health programs to implement daily brushing routines. So here we have the toolkit, toothbrushing in early education and childcare EECC programs, Brush in a Box toolkit, brought to you by the Office of Oral Health. I don't want to be the only one talking this whole time, so could I please get someone to volunteer to read this quote on page 2 of the toolkit? I can't actually see everyone, so maybe Aubrey or Gustavo, you could do me a favor and call on someone whose hand is raised.
Toothbrushing should be a pleasurable experience for childcare providers, teachers, parents, and children. If a child is hesitant to brush their teeth, teachers or caregiver, sorry, I don't have my glasses, or child care providers will work with the family to assist the child in learning to participate in this activity.
Fantastic. Thank you so much, Amanda. So this is really important to remember when you're working with teachers and child care providers to start implementing the toothbrushing routine is we want this to be something fun. You know, working with young children, it can be very challenging, but it's often very fun. And toothbrushing should be something that is not causing more stress for the children and the teachers or child care providers, but it should be something that is enjoyable. So we'll talk a little bit more later about how to make this experience enjoyable, but it really is something that you want to make sure that those providers know. Shouldn't be something that should be forced upon the children. Children should never be forced to brush for a certain amount of time. They just should be encouraged, and the adults should be modeling it being a positive experience. So let's move forward. On to page 3, we have the table of contents. As we go through this toolkit, there's going to be a lot of words, and I'm not going to read through everything. You'll have a chance to have this toolkit in your hands, and you'll be able to go over any sections that you feel like you need to learn more about. But I have highlighted some various areas on pages that I'll be talking a little bit more about. So if there's your handy dandy table of contents. This is a section on from the dental director, from Dr. Kumar. He states that tooth decay is one of the most common childhood chronic diseases, and we all know that it is preventable, although disparities in the prevalence of tooth decay with respect to income, race, and ethnicity, as well as parental education, are profound. So with the help of excuse me, my heart's racing because I'm so excited. So of course, implementing these toothbrushing programs can help to reduce the risk of developing tooth decay. And local oral health programs such as yourself should consider this an effective strategy to promote oral health. As most of you, if not all of you know, 54% of children entering kindergarten are starting school with tooth decay. That's an alarming high number. Can I, by show of hands or an emoji, see how many of you would like to see that dental decay rate in California go down? I know I would like to see that go down. And I know that the county I live in, it's also over 50% of incoming kindergartners starting school with that type of dental decay. That's absolutely heartbreaking when we know that it's preventable. Awesome. I'm seeing lots of showing of hands, lots of thumbs up. And by implementing a daily toothbrushing routine into these early care programs, we can help to reduce that decay rate. Those baby teeth are so important, and we need to make sure that, we help to take care of them. All right, moving into the introduction section. Let's see, sorry, I've got all sorts of toolkits and things in my way. Okay, so I am going to go ahead and read this first section. Encouraging toothbrushing in early education and childcare programs helps to promote oral health and teaches children a lifelong habit. And local oral health programs, as Aubrey said, can use this toolkit as a resource to help fulfill Work Plan Activity 2.1b, number 6, which is design of an early education and care prevention program, and 2.1b, reporting measure E, early prevention program. So you and your staff can use this toolkit to train teachers and childcare providers how to implement a daily toothbrushing program and incorporate oral health education into their classrooms and or childcare programs, which is of course a part of some of our objectives as well. A brushing routine in a childcare home with children of varying ages may look different. So it's really important to use the steps for toothbrushing for the age group of the program that you're working with. Now, a childcare home that may have infants, toddlers, preschool age children, school age children, the toothbrushing procedure is going to look a little bit different. So they may need to look over the steps for multiple age groups. You can really help teachers and childcare providers to structure the brushing routine to work for them and for their childcare program. There needs to be some flexibility with this. Any of you who have children or you've worked with children or in early care programs know that flexibility is key and that you really have to work with the provider or teacher to make this program work for them and again, make it fun. There are some links in the introduction to some video examples and also a really nice checklist that came out from UCSF EDU. So we all here know that oral health is an essential component of overall health, right? But maybe not everyone in the community that we're presenting the idea of brush in a box understand that. Maybe they don't quite understand how we need to start so early on taking care of children's teeth and even wiping babies' gums and getting children used to having a toothbrush in their mouth. You as local oral health programs may be able to assist families in establishing a dental home. I put this page in here too, just so that you have some language to use when you are helping to promote this program, when you're trying to gain buy-in from administration or from teachers, and just kind of helping them to get an understand of how dental disease is that most common chronic childhood disease. When you are meeting with programs, it's really important to have some data about your own programs. So when I was working for Humboldt County local oral health program, I knew that 53% of children out on our Native American reservation had dental decay. And I needed to go and talk to their school administration and their teachers about how we could use this creative process to help reduce that decay rate. So having some of your own data and your statistics about your county and how important it is to help to change that decay rate is really important. I'm going to spend quite a bit of time here on this page because this is the steps that you can take to implement an early education and childcare toothbrushing program. This is really the heart of the Brush in the Box toolkit, of this presentation to you, and I want you to really feel comfortable with the implementation process. As Aubrey mentioned, please feel free to be putting questions in the chat as we move forward with this. If I had more time, I would be answering them as we go along, but we have quite a bit to cover here today. So the first thing that you want to do is you want to meet with center directors, lead child care providers, or school administrators to promote Brush in a Box and gain buy-in. You want to go into this with a positive attitude, and you also want to go into it with that attitude that this is serious. This is something that we need to address. 54% of children in California are starting school with dental decay or having experienced dental decay. You know, you want to really hype up these administrators to gain that buy-in. And you want to talk to them about what is Brush in a Box. Well, Brush in a Box is a toothbrushing program, a daily toothbrushing program that can help to reduce dental decay. And All the materials and tools that you need are in a box, brush in a box. After you gain that buy-in and you have administration or a lead child care provider saying, yes, I want to do this, then you're going to provide some sort of presentation for the teachers and staff. When I went out to the Native American reservation and I expressed to that administration, we need to do something about this, they said, absolutely. I want you to meet with as many of our teachers as you can. I showed up at lunchtime and I met with as many teachers as would show up and talk to them again about the need and what they could do to help. And the stories just kept pouring in about children who'd been in their class with dental decay. And again, how heartbreaking it is to see children that are hurting and not seeing any follow through happening at home. So this is such a great preventive measure that we can use to help those children. So you're going to give your spiel to the teachers and child care providers. You're going to get them interested. You're going to let them know that this is doable and talk to them about how it's doable. You're going to show them what's in the kit. You're going to have those teachers and child care providers sign up. And there's a program agreement in the toolkit. We'll take a look at that a little bit later. Why might we want to use a program agreement? Could I get somebody to just share an idea of why we might use that program agreement? Again, I can't really, oh, there we go.
Accountability.
Fantastic. That's it right there. Accountability. And it's not just holding the program itself accountable and making sure that they are implementing this toothbrushing program. It's also holding you as the local oral health program accountable because you are setting out to say, I'm going to help support you in starting this toothbrushing program. And you're going to work together and you're going to say, I'm going to uphold my part of walking you through this. You're going to uphold your part of actually implementing the program. What we don't want to see is these brush in a box kits sitting up on a shelf or stuck in a cabinet. We want the children brushing their teeth every day. So it's very important that that program agreement is included in the brush in a box. Then you're going to go over the safety and sanitation guidelines. Very important, especially given COVID, right? We really want to make sure that the safety and sanitation guidelines are being followed and that they have a clear understanding. As a teacher, I would go into classrooms and I would see children dropping their toothbrushes on the ground and go to try to pick them up to put them back in their mouth. Oh my goodness, like the amount of unsanitary practices that can happen with toothbrushing, there's a whole list of them. So teachers really have to be on guard. They have to make sure that children aren't taking the toothbrush and sticking it up the faucet and, you know, dropping it in there, using another child's toothbrush. So it's very important that they're familiar with these safety guidelines. When I was an education coordinator and I would go and observe this process, I actually saw teachers who would put toothpaste onto a paper towel or a cutting board. They would scoop up a dollop of toothpaste with the child's toothbrush, take another toothbrush, scoop up a dollop of toothpaste right into the other smear of toothpaste. So there was cross-contamination going on. At North Coast Children's Services, when I started seeing that happening in Head Start classrooms, I went back to administration and I said, I need to rewrite the safety protocol for toothbrushing because this cross-contamination is not okay. This should not be happening. So this is an updated safety and sanitation guideline. You're also going to want to go through the toothbrushing procedure. And as I mentioned earlier, there's a procedure for varying age groups. So if you're going to go into an early Head Start program and talk about brushing in a playgroup, that's going to look very different than if you're going into a kindergarten classroom and you're talking about brushing around the table. So pay attention to that age group there on the toothbrushing procedure. The next thing is to offer to model the process. If any of you are like me, then you're a hands-on learner. For me, I think it's very important to actually see what is being asked of someone. So if you have the opportunity to go in and actually say, here's the brush in the box kit, here's what's in it, here's what the materials look like, here's how they get set up, and here's how we do the brushing. Actually walking them through and modeling that process is really important. If you yourself or whoever the health education specialist is or one of your staff members doesn't feel comfortable actually brushing their teeth, then you can use a tooth model or you can use a puppet. So there's definitely different ways to model the process. Then you're going to want to give an oral health education lesson in the classroom or child care home, or provide oral health curriculum, or both. Ideally, you're going to be doing both. So again, part of our work plan activities is to provide those oral health education lessons. Hopefully you have the staffing to be able to do that. This is extremely important because this is where you get a lot of the buy-in from the children. So you get them excited about toothbrushing. You get them understanding why it's important for them to take care of the teeth. And you really put that power in their hands. I love going into preschool classrooms and saying, how many times a day should you be brushing your teeth? 2 times. How many minutes? 2 times. You get them all amped up about toothbrushing, and you get them to start to understand why they're being asked to do this every day. In the same way that when children come into a preschool classroom, they're asked to wash their hands. They understand that you're coming in from outside or from home with germs on your hands. You need to wash them before you eat breakfast, right? You also need to be brushing your teeth to take care of those germs in your mouth. So that is very important. There are some examples of oral health curriculum a little later in the toolkit that I'll touch on. Then offering support with implementation. As I mentioned, with that accountability, this is your piece as local oral health programs. You are offering this support. You're going to them and you're not just handing them a toolkit. You're saying, I'm here to support you, and you have the resources you need. This toolkit is really meant to be a comprehensive guide. I tried to keep it as clear and concise as possible to walk through every step that you're going to need to help to implement these programs. And you want to get comfortable with it and then help the programs that you're working with to get comfortable. So then this is a tricky one. You're going to have to find out, can you provide the brush in the box supplies? Or are you going to need to go over the cost analysis and help them to budget for the materials? This is something I'll touch a little bit on later. There are some creative ways to think about this. This is something that's going to be different for each individual county. What I suggest is that you do have the funding available to be able to at least get programs started with maybe an initial brush in a box kit. You can see if there is a local dentist, perhaps a private dentist, who wants to sponsor this program. You could work with your Office of Education to see if they possibly have some funding to be able to get this program going. And the more stakeholders that you can get involved in this, the better. The more that you can help the community to understand that this could really help to change the data on decay rate for incoming kindergartners. So again, the cost analysis we'll look at a little bit later. Then you want to go over the checklist, which is provided in this toolkit, to make sure that teachers, child care providers have everything they need. Teachers especially, they love checklists, and teachers are busy. They have a lot of paperwork. There's a lot of children in their care. So having that checklist is really great. Even putting it right up on the wall next to where your toothbrush holder is for when you have substitute teachers coming in, or maybe there's a parent volunteer. You want to make sure that they understand what's needed for the daily toothbrushing. Then observe and review the brushing routine to make sure the safety and sanitation guidelines are being followed, and very important, make sure that everyone is having fun. My suggestion is that everything that you see in bold here, that program agreement, the safety and sanitation guidelines, all of that actually come in your toolkit. And when you fill out that program agreement with the program, you keep a copy for yourself and you put a copy of their signed agreement in that brush in a box, so they are reminded of what they signed up for. Okay, discussing successes and challenges, and make improvements as needed. On the survey and supply order form, there is a section that programs can fill out on what's going well and what challenges they're having. And when you go back in after having observed the brushing program, you can give them that survey and supply order and say, hey, fill this out. And then next time we meet up, we can talk about how we can make improvements in the program. I know that in implementing these programs, I found that the successes greatly outweighed the challenges, and that the teachers and child care providers that I worked with had so many positive things to say, and that the children really loved the daily toothbrushing program. Then you can use the survey and supply order that's provided in the toolkit. They can let you know when more supplies are needed, or they can use it for themselves as a reminder when they need to reorder. And finally, discuss the sustainability of the Brush in a Box program. This is not a program that we want to just see come and go or last for a week or even a month or even a year. We would like to see this program year after year with each new incoming group of children or children in a childcare program or in a classroom. So these are really the condensed steps that you can take to help implement the early education and childcare toothbrushing program. Okay, that was a lot. I need a drink of water now. Okay, moving forward, page 8. Reasons to implement a toothbrushing program. When you're meeting with those admin, when you're meeting with those teachers, you're going to have to talk about, why are we doing this? Now, we know why we're doing this, but maybe not everybody does. Sometimes you might have to meet with a group of parents, or the programs that you're working with are going to meet with a group of parents, and they need to know that by implementing a classroom or childcare toothbrushing routine, children learn the skills they need to take care of their own teeth and gums and gain knowledge of why oral health is important. Again, this is something that we know, but we really need to make sure that everybody's on the same page and understands that this is an important skill, a lifelong skill that children are going to be learning. Now, again, we all know that dental issues can cause an inability to learn or concentrate, social emotional delays, behavior issues. I was working with a superintendent who said that he had a lot of dental issues as a child, and then it really affected his school attendance. It affected his behavior. Well, a child had been having a lot of behavior issues in school, so much so that it went all the way up to the Office of Education, and the superintendent got involved in his behavior plan. When the superintendent met with this child, he noticed that the child was holding his face, and he immediately thought, wow, maybe this child is having dental issues like I did. Well, sure enough, that child's mouth was riddled with dental decay. And he was able to help the child get the care that he needed. And once he did, guess what? A lot of his behavior issues turned around. His school attendance increased. He was able to learn and concentrate, and it helped the family as well. And so it's really important to remember stories like that, and to have your own success stories like that to share with your stakeholders, to share with administration and teachers. Often when you're talking to these programs, to these teachers, they're going to have stories of their own. That superintendent just chose to share that story with me while I was talking to him about the importance of school oral health programs. So, make sure to, collect those as they come along. We know that children with severe oral health issues may be embarrassed to smile, afraid to speak because they're in pain or they can't keep up with their peers. Another experience that I had is I had a call from a principal. A principal said, I have a teacher telling me that there's a child who will not take their mask off. This was after masking was no longer required. And she said she was very concerned because the child was even putting food underneath her mask to eat at lunchtime, and she didn't understand what was going on. My team at the time got pulled in to do a dental screening. Another child whose mouth was riddled with dental decay. And it was just heartbreaking to see that. We were able to contact the family, help them with the resources to get that child the care that they needed. So again, these are just all reasons why implementing this toothbrushing program is so important. That child was a second grade child. Had that child been doing toothbrushing from pre-K up through second grade, maybe they wouldn't have that mouthful of decay. So it's really something to think about. And one more point on this page here is just that parents and guardians with oral health problems may have some of the same issues, right? So they may have trouble with employment. They may be having a lot of discomfort and illness. It may be affecting their parenting. If any of you have children or you've worked with children and you're in pain, you're not feeling good, even if it's a headache, it affects your ability to be patient. It is harder to work with them. It's harder to function. And so they may need oral health help and support too. When doing case management with children, I've found that it really takes working with the entire family, because often if the child's dental cares aren't being taken care of, if it looks like the child's oral health is neglected, there's probably something going on with the parents or guardians or the siblings as well. So it's just important to make sure that, if possible, the programs that we work with understand that the whole family may need some support. And where might that support come from? The local oral health programs, hopefully. Okay, could I please get someone to read this beautiful quote here? Whoops, if I can stay on the page. Again, Aubrey or Gustavo, would you please call on someone?
By implementing a toothbrushing routine into a playgroup setting, parents acquire the oral health literacy and education to know how to take care of their children's teeth from the beginning.
Fantastic. Show of hands, how many think that's important? The education piece, right? And oral health literacy, there's our buzzwords right there. I mean, my goodness, it's all about education. As a teenage mom, I didn't know how to take care of my child's teeth at all. In fact, I used to dip my son's pacifier into lemonade or soda. One time on a long car ride when he was an infant, I actually dipped his pacifier into a sugar packet and put it in his mouth because it got him to stop crying, right? It got him quiet. Had I known that could actually affect his little teeth, then I probably wouldn't have done that. And so it is really about that education and having your own experiences, your own stories, or those of others that you can share with your programs to have them share with their families, because we don't want any of these families to feel bad for not taking care of their children's teeth. Now, of course, there's those instances of pure neglect, but in most cases, there's a lot going on in this world, right? There's a lot going on these days. I don't know about you, but I have a lot going on at work. I have a lot going on at home, and taking care of my children can be really challenging at times. And it is important that we remember that not all families know that giving their children soda or candy on a regular basis, or even having them slurping on that sippy cup throughout the day, could be causing tooth decay. And so I think that quote is very important, and working with those early care programs through First Five, through Early Head Start, are extremely important. So here is the process for taking care of those little baby teeth and gums. Moving on, we have the procedure for taking care of children's teeth ages 1 to 3 years. So this is still going to be where the teacher or child care provider or parents, if they're there in this type of program, they will still be doing the brushing for the child. Now, in some cases, it may be that children are in their high chairs and they're provided their little toothbrush and able to chew on it for a bit. And then the child care provider is taking turns to help with that toothbrushing, making sure to put on new gloves in between each child. But this is not going to be the round the table toothbrushing that you'll see in the video examples. That's going to be more for pre-K. So this is still that baby brushing, infant brushing. Then we're moving into toothbrushing for preschool age children. I'm not going to read through this whole procedure, but this is the classic round the table toothbrushing. Many of you may have seen the video on the Early Child Learning and Knowledge and Learning Center through the Office of Head Start that promotes the round the table brushing, which really is the new best practice for toothbrushing. A couple of things I'll point out here is, one thing it says is toothbrushing will be scheduled at least once daily after mealtime. Now, remember earlier when I said we need to make sure and have flexibilities with our programs? We don't, as the oral health program, want to tell them, you need to make sure the children's teeth are brushed after lunch. That's not up to us. Maybe they want to brush after breakfast. Maybe they want to brush after lunch. Maybe they want to brush after an afternoon snack time if it's an all-day program. Or maybe the teacher says, I think the only time that I could fit this into my program routine would be right when children enter the classroom after they wash their hands. I could have them brush their teeth. That's great, right? What we want is daily toothbrushing. So it really isn't up to us to tell them when that should occur. We do want to, again, make sure that those safety and sanitation protocol is being followed. Some of that is listed in here as well. But this walks through those steps for round the table brushing. It's a no water brushing method where children have their toothbrush, their toothpaste on the rim of a cup, they scoop it up, they brush ideally for 2 minutes, they spit in that cup, they have a napkin to wipe their face, they stick that napkin in a cup, that gets tossed, toothbrushes get rinsed, and that's really the process. So this one is a 2-page process, and I do want to take note that I mentioned this earlier, longer duration of brushing leads to more plaque removal. We know that. 2 minutes, right? 2 minutes, 2 times a day. So timers can be used as a visual aid, and they can be really helpful when working with preschool children. But children are encouraged but never forced to brush until the timer is finished. So when you go in to observe these programs with the toothbrushing, if you see that children are being forced to sit at the table, and maybe there's some type of like, okay, now you're gonna have to go sit in the corner because you're not brushing, that of course is not going to be okay. So you want to make sure and talk to the staff and administration about, this isn't appropriate for toothbrushing. We want this to be a pleasurable experience for all involved. We want children to want to brush their teeth at school and at home. So that's just an important piece I want to point out there. Moving on to page 13, I won't read through all the safety and sanitation guidelines, but again, these are extremely important for programs to be familiar with. And you do want to remind them to follow their current COVID guidelines, guidelines available through CDC, CDPH, and their local public health program. So since this will be happening all across California, you will be working with your individual county and those programs to understand what the guidelines are as far as masking or what type of disinfectants are used in the classroom or child care home. At the bottom of this page, there is a list of some various disinfectants that could be used. However, these programs, if you're going to a Head Start program where maybe they're just bringing toothbrushing back after COVID, they're already going to have a cleaning solution that they use to disinfect their sinks and tables. So as the local oral health program, you're not going to go in and say, hey, I want you to use HDQ neutral while you're brushing teeth. It's going to be up to those programs to follow the details that are listed in these safety and sanitation protocols. All right, now let's get to the forms. These are going to be extremely helpful for you when implementing these programs in the community. This is that Brush in a Box program agreement. This is like, I think it was it Amanda or Ivy or somebody said accountability, right? This is where we're going to hold the programs accountable. They are going to say, today I'm signing up for the Brush in a Box program. I received blank months worth of toothbrushing supplies for my classroom or childcare. My suggestion, if as a local oral health program, you're going to just get them started and you're going to be able to put the toothbrush supplies together in a box for them, I would have that say one. I would give them 1 month's worth of toothbrushing supplies for their classroom or childcare home. I would make sure that they understand what the box includes. I'm not going to read through all of these materials, but that's included there for you to know what would typically go into a Brush in a Box kit. And then they will be signing that they follow the safety and sanitation guidelines and that they use the toothbrushing procedure for the age group that they work with. And then you'll see there, the local oral health program is mentioned at the bottom there. You will check in after 1 month to see if they have implemented a toothbrushing routine into the classroom or childcare home. Then there's that opportunity for them to ask for additional support or training. And if they've said, you know what, there's too many challenges, then maybe you can help them troubleshoot through some of those challenges. You can talk to them more about maybe experiences that another childcare program has had, or maybe you can talk to another county about some of the successes or ways that this program has worked. I know when I was working for Humboldt County Local Oral Health Program, as soon as one preschool program started this, another one wanted to start it. Everybody wanted to join in on the fun and helping to bring down that decay rate in the county. So I really feel like your community is going to have a lot of interest in this. You can approach state preschool programs. You can approach those Head Start, early Head Start programs that may even already be doing toothbrushing, but perhaps they're not doing toothbrushing around the table, which again is that new best practice. So maybe they just need a little bit of brushing up on their toothbrushing routine, and you can help walk them through how to do that. Or you may be opening this up to local childcare providers who have never done toothbrushing in their programs before. So you'll be starting from scratch. Whatever you're doing, using this program agreement is going to be extremely important. Then you've got that checklist. I mentioned this is something that's important to have printed out up on the wall. It says that you've read that toothbrushing procedure and safety sanitation guideline. Ideally, they've watched the video that I mentioned from eClick that is called Growing Healthy Smiles in Early Care and Education Programs. I've watched this video 1,000 times when I was helping to implement these programs. It just really helped to show this to the teachers as well, so that they could just get an idea of what this might look like. And the video is really geared more towards brushing, again, around the table in a preschool program. So reminding early child care providers, like in an early Head Start program, that's going to look different for them with younger children. And then if you're working in an elementary school, I mentioned earlier how I went out to the Native American reservation and actually approached an elementary school. We had children brushing all the way from TK through 8th grade, and it looked different than in an early care program. Children were brushing in their desks. So there was a little bit of tweaks there that, we could change the routine. But important for them to set a regular time in daily brushing. I mentioned that it's not up to you as an LOHP to choose what time that is, but it is important to express to them that they should have a consistent time. If they chose to be brushing after breakfast every day, they should brush after breakfast every day. They really shouldn't brush after breakfast every day on Mondays and Wednesdays, and then the other days they're brushing after lunch. The young children, as I'm sure many of you know, need that consistency, so that's important. Okay, moving on. I'm not going to read through the rest of the checklist. You'll have plenty of time to look over the toolkit at your own convenience. Then here we have that survey and supply order. This can be provided to you if you are providing those supplies, or perhaps, like I mentioned, maybe there's another program, an Office of Education, a pediatric dentist, someone else who is kind of sponsoring these supplies or the funding for it. So it's an opportunity to be able to say, hey, I need more of these. Or if the program is purchasing themselves, they can take note of what they're running low on ahead of time. And then they can also share how the implementation has gone, their successes and their challenges. And we can look at a few of those that have been shared with me a little later. So, of course, you want to support toothbrushing at home as well. And you want to help the programs that you're working with who are implementing this into their daily routine in their program to also be reminding families of the importance of brushing at home. So of course, it's recommended that children have additional brushings at home and that the adult do the brushing for the child at least one time a day. And these, again, this toolkit, I really tried to provide a lot of language for you to use with those programs, because I find that even sometimes early care providers, they don't really realize that children don't have that manual dexterity to brush their own teeth until they're 8 years old. And a lot of parents don't know that. And so these are just really good little tidbits that you can use when you're talking to various audiences. And you'll see, again, there you are, local oral health programs. You may be able to provide families with information on dental hygiene and dental supplies as needed. I found that working in the oral health program at the county level, we had to inundate the county so that they knew about us. So they knew, hey, there is a county oral health program. We can provide resources. We have things for you. And then you build your community partners. So it's very important to have access to a lot of resources that you can share with those programs. I included a few here. Of course, we all love Brush Book Bed. With my background in early childhood education, I love to promote early literacy. And so this is fantastic because it promotes early literacy and promotes oral health. Now we want to also provide oral health education in those classrooms. And if we or you as local oral health programs can't be doing that, then you want to make sure that the programs themselves are doing it. You want to make sure that they're promoting oral health by including oral health curriculum into their curriculum guides or into their curriculum lessons. So here are some links here to some of our favorite curriculum available. They are for some various age groups. So again, it depends who you're working with, but you can talk to them about the best way to make sure that there is ongoing oral health curriculum. It can really fit into kind of a health and safety component of education. And in a lot of cases, like with Head Start programs, it's in their policy requirements. They need to be providing dental health education, but not all of them are. So you as a local oral health program can say, hey, are you providing dental lessons? Are you actually noting those on your lesson plans? And then you can get them thinking about that and help them with that. One of my favorite things at the county level was providing dental kits. And I put together dental kits that included puppets, dramatic play props, books, toothbrushing charts, anything that I could really think of to help support children and families with good oral health practices. And this also helps to ease anxiety about going to the dentist. So something that a lot of these early care programs loved was that if I said, hey, I have this really cool dental curriculum education kit that you can use in your classroom for 3 weeks or a month or 2 months, however long they wanted it. And then again, that kind of helped with that buy-in. That helped them think more about toothbrushing. Sometimes classrooms actually would set up a little mock dental office with dental puppets and the big teeth models, and they would let children kind of play dentist and look at books and hold up dental mirrors and things. So that can be a really great thing that you as an LOHP can provide for programs. And then there's a variety of other resources, which of course, many of you are already providing these type of things to the community, to various programs, but maybe there's something on there that you haven't thought to provide, or maybe there's a partner that you work with, an Office of Education, First Five, who has some of these things available that you could share or use, or you could ask them to make sure that they're getting out there into the community. So I find this page of the toolkit extremely helpful to get you doing those education sessions as well. Then we have some successes and challenges shared here. Could I get a volunteer to maybe just read a couple of these? I would really appreciate if somebody else would talk for a moment. Gustavo, would you call in someone for me?
Sure, definitely. Can we have maybe Brandy Matson?
Hi there, sure, no problem.
Thank you.
So on this page, it's not every student is able to brush their teeth at home. So doing so at school has been very successful. And that was from a special day class teacher. Everyone is compliant and enjoys brushing their teeth. That's from another teacher. Students enjoy it and it is quick and easy. That's a 4th grade teacher. We put on a toothbrush song to brush our teeth to for 2 minutes, 1st grade teacher. I concur, that's a great tip. Not everyone likes the toothpaste. Well, that is a downfall. That's from a teacher. Students look forward to brushing their teeth. They are brushing for the full 2 minutes and brushing better. That's from a pre-K teacher. Students still have trouble brushing even with modeling. That's from a teacher. Children love this activity. That's from a home daycare provider. And I wrote a 2-minute toothbrushing song, and every day I play my guitar and sing while the children brush their teeth, and they love it. That's a great kindergarten teacher.
Oh, Brandy, that was awesome. Thank you for reading through all those. I really appreciate it. And you can see that really those successes outweigh the challenges, right? Of course, not every kid's going to like the toothpaste. Well, when we had the funding available, we actually provided multiple types of toothpaste in the kits. And then we, depending on the age group of the children, we surveyed the children. What kind of toothpaste do you like best? So there's kind of fun ways to work with some of those challenges and to work around those challenges. It may be that just not every child's going to like the toothpaste. Maybe they're not going to use the toothpaste and they're just going to brush with the brush, but that's better than nothing. So there's a lot of fantastic things on here. I worked closely with that teacher who played his guitar and sang while the children brush, and his classroom was so enthusiastic about brushing their teeth. One day I walked into the classroom to do an education lesson, and the child had drawn a picture up on the wall, just adorable picture. I wish I could show it to you right now. And underneath it said, "When I grow up, I want to be a dentist." And it just made my heart so happy to know that that toothbrushing and the teacher engaging them and singing about his 2-minute toothbrushing song actually made that child want to grow up and become a dentist. And that was a kindergartner, right? So really happy to hear those success stories. We're going to wrap it up here pretty soon. Let's see. Okay, so right here, a little Humboldt County highlight. When I was with the Humboldt County Local Oral Health Program, I coined the term brush in a box, and then our program took it a step further, and we brought that program into elementary school classrooms. So I mentioned that before. We got K through 8th brushing. So this isn't just the early care. Of course, that's what we want you to focus on. We want you to get out there and, you know, make sure that the early care is brushing to help change that decay rate of incoming kindergartners. But if you have the capacity, or let's say you happen to work in a really small county like I do, maybe you couldn't have a further reach and bring this to elementary classrooms as well. Because how fantastic would it be if all grades and all ages eventually were brushing their teeth daily? That would be amazing. So I did include a cost analysis here. We determined that implementing such a program for one school year, which is 180 days, for a classroom of 20 children would be approximately $600. So that's a really small price to pay compared to the consequences of a child not receiving proper oral health care. And that's a piece of information that you can bring to to the administration, to the private dental practices or the Office of Education, First Five, whoever you're really trying to kind of help you build the sustainability around this program, and show them this breakdown. Again, I mean, that whole year for a classroom of children, really, that is not very much. I mean, you can see the breakdown here when you get the toolkit, but I wanted to make sure that, again, it's comprehensive for you. You can see it right in front of you. This is how much it would cost. And there are certain ways that you could supplement, or a lot of programs, they already have napkins, or they already have cups, or you can use paper towels instead of napkins, or, you know, a lot of classrooms or even childcare homes have some of the materials already. So maybe they don't need everything purchased for the Brush in the Box program. So I just want to, again, remind you that this is a best practice that's recommended by the Office of Head Start and also the California Department of Public Health Office of Oral Health. It's really exciting to be able to present this Brush in a Box toolkit for you today. I've put a lot of time and love into putting this together. There are some resources available here and some contact information. And then on the final page, I put in this little dental decay process graphic, which we used a lot at Humboldt County LOHP. It was a really great little education graphic to use with both children and adults to help them understand that dental decay process. And again, why daily toothbrushing is so important. So let's together help to reduce that decay rate from 54% to 0%. Let's see those incoming kindergartners years down the line coming and starting school with no dental decay. Can I get a thumbs up if that's what everybody would love to see? How fantastic would that be to have children not in pain, children who are able to concentrate and learn and be healthy and happy as they should be, right? Okay, well, thank you all so much. I am going to stop sharing and then I will launch another poll. Aubrey, when you're ready, let's go ahead and launch, or I should say I'm going to launch the same poll. How comfortable are you now with the idea of helping to implement an early care program? Oh my goodness, look at that. Okay, answers are coming in fast. I'm seeing a lot of very comfortable, some still somewhat comfortable. That's okay. There's going to be more technical assistance available. Some that are neutral, that's okay. And I know not everyone here is going to be doing that, but look at that. We're getting significant amount of answers. We're looking at 68% right now, feeling very comfortable. That number went up. 28% somewhat comfortable. This is looking amazing. We don't have anyone that's feeling uncomfortable. And okay, nobody right now are saying they need more technical assistance. So it looks like that toolkit is definitely a comprehensive guide for you. Again, I know we all have busy lives and a lot going on, so thank you so much for taking the time to be here and to hear about Brush in a Box. I hope you have a great time helping to implement these programs and that this can be a useful guide for you. Thank you so much, everybody.
Thank you, Sierra. That was amazing and very comprehensive. You're getting a lot of kudos in the chat. So I hope you get a chance to read through that. We have some time now for some questions. If anyone, I'm scrolling through the chat, and I don't think I see any just yet, but if you have a question, you can post it into the chat or you can raise your hand and unmute.
Yeah, hi, everybody. I just wanted to see if there is a PowerPoint presentation that you guys have that we could utilize when we go out to different sites to promote the program.
That is something that I would definitely be willing to work with you to come up with. I find that when it comes to PowerPoint presentations on Brush in a Box, it's really important to tailor it to your specific county. And you know your data, you know your schools, you really know kind of what your county looks like as far as their need and your access to dental care. And so that's something that I would definitely be happy to provide or to work with you on. And you could also take the information from the toolkit and even copy and paste some of the pictures and the information into a PowerPoint to help create that. Thanks, Andrea.
Great, thank you. Are there any other questions for Sierra? I did post in the chat a link to the toolkit, so you have access to it, and it will also be sent out an email afterwards. Okay, I do see a question from Jennifer in the chat. I need more talking points. The most common barrier I get from teachers is that it takes too long. I tell them if they break for snack and lunch, there is time for brushing. Do you have any other suggestions?
Sure. So one thing that kind of helps save time, and again, I don't know what specific age group you're talking about, but a kindergarten classroom, for example, if they happen to have a teacher's aide or they could pull in a parent volunteer, if you can prep as much as possible beforehand. So what I would do is I would get some of those lunch trays. Most classrooms even just already have those for art projects or small group projects, and you actually get your cups with your toothpaste on the rim, and you get all your materials prepped and ready to go. So then let's say you are going to do brushing after lunch. If you could have your teacher's aide or your parent volunteer or someone actually set that up, during the lunchtime to have it ready to brush after lunch, it saves a lot of time to get those materials passed out. And then, involving the children too, depending on the age group. If you have a child who can go around and pass those napkins out at the same time the teacher's passing the toothbrushes out to the children, there is ways that it could be saved. And I know I definitely, got that complaint sometimes from teachers as they were beginning implementation, but generally after they really got into the groove of the routine and children understood what was expected of them, it kind of, began to go smoother and the time was cut back on. So hopefully those little tidbits help. And again, I'm always happy to offer more technical assistance at another time to brainstorm that and also help you with more talking points. Thank you.
So wonderful, wonderful presentation.
Thank you so much, Aubrey. I was just going to throw in, I really did my best to make sure that it was a very comprehensive guide, but that it was also user-friendly. So I know that there's been sometimes implementation toolkits, even the Brush in the Box Toolkit implementation guide, that's very wordy, that has a lot in it, and it can be a little overwhelming. We're all busy, programs are busy. So the toolkit is really meant to be something that is usable so that it doesn't just get stuck into a binder and put up on the wall. We want it to be usable for you and the program. So, I mean, it's only 20 something pages long. So hopefully that's helpful.
There's a question in the chat, Sarah, if you wouldn't mind sharing your contact information. Okay, fabulous. Oh, and Andrea has a comment. We have about 25 Head Start and preschool classrooms in El Dorado County, and all of them brush teeth in class. That's fantastic. Wonderful. Thank you for sharing. Okay, at this point, I think if there aren't any other questions, we will turn it over to Sal and Maria at Smile, California.
Hello, everyone, and thank you so much for joining us today. And of course, thank you to COTAC and UCSF for inviting us to join this presentation. So the purpose of today's presentation is to familiarize you with Smile, California and the many tools and resources you can leverage to help raise awareness of the importance of regular dental checkups for your own National Children's Dental Health Month efforts throughout the year. Our plan is to talk to you through the comprehensive presentation today of the campaign and its many resources, and then we're going to do a very top line live demo of smilecalifornia.org. So as Aubrey mentioned, Smile California is a Medi-Cal Dental's program awareness campaign that's designed to educate more than 14.5 million Medi-Cal members about their available dental benefits. Our education includes addressing known barriers such as not having a dental home, members not being aware of what their dental benefits covered, and lack of awareness. We then use the various communication channels such as statewide and local partner engagements, grassroots distributions, paid social media, and news media to reach Medi-Cal members across California. So although all children enrolled in Medi-Cal have dental coverage, in 2020, 21% of adults and less than half of children use their available Medi-Cal dental benefit. So our campaign, the three primary member outreach objectives are to increase awareness of the importance of oral health, improve knowledge of how to acquire services within Medi-Cal Dental, including understanding their benefits and how to receive scheduling assistance, and encourage members to find and continue receiving dental care services, particularly its preventative care. So as many of you are aware, dental health is an important part of our overall health. This is particularly significant in the connection in the health of a child because healthy teeth not only help children eat, speak, and sleep better, but ensuring a child is not distracted by tooth pain helps them perform better in school. This is just one of the many reasons why National Children's Dental Health Month is a perfect time to encourage parents and caregivers to make sure their children brush up on their dental health habits. But in order to really make a positive difference in the oral health of our state's Medi-Cal population, we of course need your help. We need everyone to join us in a unified effort to better educate parents and caregivers about their available dental benefits, but to also connect them to care. So for National Children's Dental Health Month in 2023, Small California is going to be focusing on the importance of preventative dental care by inspiring Medi-Cal members to love their teeth and visit the dentist regularly during the month of February. We are going to continue to use a superhero theme from last year, and in addition, we're going to weave in messaging and elements to encourage Medi-Cal members to love their teeth. Given that Valentine's Day occurs in February, this new component is engaging, timely, and will resonate with children and their families. So to reinforce them to love their teeth, and this theme is going to tie back to children's dental health. So as a frontline health professional and educator and partner, you play a significant role in connecting Medi-Cal members to the care that they need. Your influence goes a long way, and you can help us to inform Medi-Cal members in your community about the dental benefits that is available to them. Now I'm going to hand it off to my colleague Salvador, who's going to address how you can support National Children's Dental Health Month and the available Small California resources.
Thank you, Maria. So as we do every year, Smile California will provide old partners with new messaging and resources about the Medi-Cal dental program and the importance of establishing good oral health habits like visiting the dentist twice a year or more early in life. New resources that we've developed for National Children's Dental Health Month 2023 include 6 social media images and captions in English and Spanish for Instagram and Facebook, as well as tweets for Twitter. 3 email banners for partners to add to their email signatures or, add to their websites or anywhere that you would like to, add a JPEG that, talks about this and goes to our website. 3 website banners in English and Spanish, just like I was talking about, that you can add to your website to embed and hyperlink out to smilecalifornia.org. 1 Love Your Teeth children's activity packet, as well as email content for partners to share with stakeholders and or Medi-Cal members. And again, this is in addition to the many resources that we've developed in years past, which will continue to be on our website and be available for download in case there's anything there that your team really enjoyed and wants to continue using. So the backbone of our campaign is smilecalifornia.org, which is a user-friendly gateway to the more in-depth features offered on the dentical.ca.gov website. This website is available in English and Spanish, and it was truly designed to keep the Medi-Cal member and organizations who are on the front line interacting with members in mind. So it's the central hub for us to provide information to members and partners about covered services, oral health tips, and offers a variety of downloadable resources, including, as you can see here, presentations, activities, videos, flyers, brochures. We also have landing pages available in 17 languages, which are accessible by clicking on the globe icon at the top of the website. And most importantly, the website helps connect members to care through the Find a Dentist button featured throughout the site, which then leads members to the resource on the Dentical website, on the Medi-Cal dental website, for them to easily locate a Medi-Cal dentist in their area. Now, in honor of National Children's Dental Health Month, we've updated our dedicated NCDHM page, which features digital campaign materials such as social media posts, captions, videos, and children's dental health education packets. This material, the new material will be available on the webpage the first week of February, but there is like I mentioned earlier, existing material from last year that's available for you to download and share with your community. Social media posts, like I mentioned earlier, these are available on our social media gallery, which is one of the most used partner resources on our website. And this page features an intuitive library of social media images and recommended captions available in English and Spanish. And next, I'll do a quick walkthrough of the NCDHM webpage as well as the social media gallery to just kind of show you guys how easy it is to access all of these things.
Sal, there is a question on the chat that says, are we required to submit media requests when using National Children's Dental Health Month materials from Smile California on our social media pages, or are these pre-approved?
No, so if you're going to be just using any of our resources to post on social media or anywhere, you don't have to ask for permission. Everything that's available on our website is available for partners and organizations to freely use on their own communications channels as they wish. I do know in the past, we've worked with LOHPs to adapt some of our assets for them to use in paid media. And I know for that, we do need to submit a request to CDPH because I know that they use funding from them as well as DHCS just to get approval on using these things for advertisement. But to just download something and then post it on their social media pages doesn't require any permission or anything like that. And here we go. Perfect. So this is our the home page here, and I will go specifically to the NCDHM page. And when February starts, there will be a homepage banner right on the homepage that will allow people to just easily click over to this page from the homepage in honor of the month. So you can see here, this is our NCDHM landing page. This first page here is kind of a short about what NCDHM is, talking about how at-home care is not enough, and linking some of our top materials. But then here on the left, as you can see, we have sections for resources for parents and caregivers, and then these are going to be our general resources that are educational that parents and caregivers can access and read. But what I do want to mainly highlight here is the resources for partners and providers section, and here there's a little bit more resources available for partners, since I know you guys will be sharing some of the things that we've talked about, like the social media posts and the web banners. And as you can see here, we have the Love Your Teeth Children's Activity Packet we mentioned earlier, and that is coming soon, as that's still currently being developed, but will launch for the first week of February for NCDHM. And as you can see, you just kind of scroll down, and all of these things have different sections that you can download materials to use with your community to promote oral health. Next here, we'll go to the social media gallery that I mentioned earlier in the presentation. And then I apologize because I think my Wi-Fi is a little slow today, but we will be getting there. Perfect. And here it is. So this is our social media gallery. It's one of our favorite resources that we have on our website, just because it's a super intuitive, easy to use gallery that shows all of the social posts that we've made available for partners to use. And, as you can see here, we have many different subject matters. Back here, this is for when we did our back to school promotion earlier in 2022, as children went back to school. And so, as you can see, there's just a lot of images that you can download to then repost. And it's super easy to download the images and the captions. You just go underneath each one of these that you like and go to download options. And then there's an option for an image in English or Spanish. And then that will take you to a page that'll have the JPEG that'll let you, right click and download that. And then to download the caption document, you just click that and it'll download a Word document straight to your downloads folder on your computer. which you can then copy and paste the caption content from there. So yeah, that's the social media gallery and the National Children's Dental Health Month page. And then really quickly, I just want to go back to the homepage and then remind everyone on the call that one of the great resources that we have on here is the member handbook, which kind of goes through the Medi-Cal dental program and everything that it covers and answers a lot of common questions and things that folks want to know about, so you can access that and either provide it to, members in your community that are looking for it, or just use it yourself to kind of guide them in their questions. And then here is the, find a dentist tool. That is something that we really love, that's on our website, that then allows people to find available dentists that accept Medi-Cal in their area. And we even have a video here that kind of walks people through how to use it. And then at the top here is where the provider search directory will be, and that's on the Medi-Cal Dental website. So now I'm going to go stop sharing and go back to the presentation. So on your screen here, you'll see an example of the social media images that we've been developing for this year's theme that Marie mentioned earlier, which is Love Your Teeth, and kind of, leans into the Valentine's Day being in February aspect. And so again, these will be available and published on the website for the first week of February for you to download, along with captions that you can then use to repost on your pages. Next here, I would like to mention that we have a dedicated outreach team with coverage throughout the state that can provide one-on-one assistance to your LOHP for, outreach events, assistance with material, any questions that you have about our resources, and their contact information is shown on the map here. I know COTEC is going to be sending the presentations that we shared today out, as well as all the pertinent links in a follow-up email, so you'll be able to download the full-size map there for you to reference. And then last but not least, we have a little sneak peek of an upcoming resource that we wanted to share. We'll be debuting a new trifold brochure titled Healthy Smiles from Pregnancy Through the Toddler Years this spring. And this brochure is intended for new and expecting parents and walks them through an oral health journey with information to help their babies be healthy and ensure that their smiles last a lifetime. The brochure also will feature information about the Medi-Cal dental program and the benefits covered by it, and then also things like the recommended amount of toothpaste for children. And this brochure is co-branded and will be included in the first 5 California kit for new parents, which we're very excited about. The brochure is going to be available in English, Spanish, Vietnamese, Chinese, and Korean, and will be available to view and download on smilecalifornia.org. So be on the lookout for an announcement from us in March once we debut this new resource that we're really excited about. We also invite you to stay connected with us by following us on Instagram and Facebook, and you can email us with any questions that you have. Perhaps you have some questions after this presentation, requests, or feedback that you have on the campaign, and you can do that through hello@smilecalifornia.org. And we also encourage you, if you haven't already, to sign up for our Smile Alerts to stay up to date with the latest Smile California news. And this is a newsletter that we send out at least once a month via email, and includes all of our newest resources and information to help you promote things to your community concerning oral health and Medi-Cal dental benefits. And so to get on the list, once you receive this presentation, that is hyperlinked there, but you can also get there by going to the Partners and Providers page on the Smile California website. And there's a section there for signing up for the Smile Alerts. So on behalf of Smile California, we want to thank you for being an oral health hero in your community. And again, thank you, COTEC, for having us on this presentation.
Excellent. Thank you so much for running through all of those fabulous resources. That was really wonderful. Thank you. There is a question in the chat from Jennifer who says that Santa Barbara County is getting ready for distribution to school dental activity handouts. Can the activity book for the 2023 be made available to LOHPs earlier than February?
Yes, we can definitely make that available earlier in February. Currently, it is with DHCS in approval. So as soon as it becomes available, we'd be happy to provide that to Santa Barbara County for distribution. Please reach out to the email that I provided, hello@smilecalifornia.org, and then we can be in touch for that.
Wonderful. Thank you so much. And it looks like there was a clarification about the earlier question. And the question is if a media request form needs to be submitted to the Office of Oral Health. And there we go. Rosanna Jackson just responded. So you can read through that and let us know if you have other questions about that in particular. Are there any other questions for Sal and Maria about Smile California resources or anything else from their presentation? You can either raise your hand and unmute and talk, or you can put it in the chat box. Well, if there are no other questions, then I want to thank all of our presenters today, Sierra from Office of Oral Health and Sal and Maria from Smile California, for taking the time to walk us through the Brush in a Box Toolkit and walk us through all of the amazing resources that are available from Smile California. We really appreciate it. We have one last poll for you with some evaluation questions. And I believe we also have a survey link that Gustavo will pop in the chat that has some open-ended questions where you can share some of your feedback there as well. But we greatly appreciate your engagement with us today. We hope you really learned a lot about Brush in a Box and have some more ideas of what you can do next month for National Children's Mental Health Month. Oh, there is a question here that came in. Does Sierra have any pictures of examples of the actual kits and toothbrush holders / stations she utilized?
There may be some pictures of the kits somewhere in the files with Humboldt's local oral health program. So I could certainly ask them if any of those exist in their files. I know that I definitely documented the supplies that went into the kits at the time. As far as the actual stations or the brushing in the classroom, I don't think that I necessarily documented that. It gets pretty tricky with children being in photos when you're in those early care programs. And I was usually doing the training and the implementation part of that, but that's a great idea. And I think that if you're able to get media approval in those programs to actually take pictures and document and put that together, and if anybody else has any photos, maybe you could share those with Marjorie as well. Thanks, Marjorie.
This is Rosanna. I just had a quick request for Sal. Is it possible to put a link to the National Children's Dental Health Month web or site right now before the banner comes up, so it'll make it easier for the LOHPs to access the resources?
Yes, sorry, that wasn't hyperlink. Let me write it correctly. But yeah, and again, the newest resources aren't there yet, but the existing ones are. And if you just bookmark that, then that'll be an easy way for you to access it as we start publishing the resources.
Great, thank you so much.
Yeah.
In that case, I want to wish you all a happy Thursday. Thank you for being here. And again, we'll be sharing a recording with you. We'll be sharing all the links that were shared today with you. And you can always follow up with us if you have any other questions. Thank you so much and take care.